Hello and welcome to CRISIL's podcast on the hospital sector. Hope all of you all are safe and healthy. In today's podcast, I would like to share the credit outlook for the hospital sector. The pandemic has caused a steep decline in occupancy levels for key remedies in hospitals as patients to the extent possible have delayed consultation and surgeries. The situation is gradually improving now and occupancy levels are ramping up. That said, the steep decline in occupancy levels and high costs owing to the precautions necessary for COVID have dented operating profits for hospitals. We expect operating profits to be lower by 35 to 40% this fiscal, and though hospitals have pruned their capex materially, the credit outlook remains moderately negative. The deterioration in performance of hospitals can be attributed to three key reasons: lower footfalls on account of postponement in elective surgeries, revenue loss from highly profitable medical tourism segment, and increasing costs. Footfalls at private hospitals have fallen significantly in the first quarter of fiscal 21 as elective surgeries and preventive healthcare, which account for 60% of the revenues, were largely postponed due to the pandemic. While the treatment of Covid-19 patients is expected to provide an additional revenue stream, but this segment is not as profitable as other revenue streams. Given the high fixed cost structure of hospitals, lower occupancy will result in lesser absorption of overheads. This, along with increased costs of maintaining safety and sanitation standards, will lead to significant decline in operating profits this year. Due to lower profitability, the cash flows are being impacted, but better receivable collection efforts and ramp up of bed occupancy levels will gradually help hospitals improve cash flows during the second half of this fiscal. The credit outlook for the sector remains moderately negative, with the credit matrix being impacted on account of lower profits. However, the deterioration is expected to be temporary and a strong bounce back is likely in the next fiscal, supported by pent-up demand as elective surgeries cannot be postponed indefinitely, and medical tourism is also expected to recoup as travel restrictions ease. We expect a healthy revenue growth of around 25% in the next fiscal and operating profitability to recover to pre-pandemic levels. With this, we come to the end of this podcast. Thank you for listening in and stay safe.